Welcome to Bite-Sized Dental Marketing. Today I have Kristyn. Kristyn's our creative director and heads up all things creative for us. And we get asked a ton about rebranding. A lot of dental offices have been named the dentist name, and they want to move to something a little more sellable and where they can bring on an associate, but also a lot of new offices.
We're going to talk about why your logo sucks, the hard tooth. Because as you know, the go-to as a dental office is to have exactly what you work on, your tooth. You know, if you are a veterinarian, you have a picture of a cat and a dog. If, you know, your health clinic, usually it's a little cross. Sometimes it's red. All these things, like it seems like the automatic go-to to just have a tooth because you're like, obviously, I'm a dentist. I work on teeth. Now, the thing that makes it weird is that it's just one tooth by itself usually. And obviously that means it is not inside the mouth anymore. It's a dead tooth. It's a yanked tooth. It's a wisdom tooth, whatever it is. It's not in your mouth. So it seems opposite of what they're trying to do, which is restore teeth and keep your full
keep your
mouth full of teeth.
Do you know how we know the toothbrush was invented in Mississippi?
How?
Because it's not called a teeth brush.
It's so stupid. The one tooth. You just keep that one healthy, and you can bite into an apple just fine.
You can gum your steak.
Yeah.
It is true. The stylized tooth is awfully overdone.
Common one I've seen now is the two squiggles. So they're like this, and they're like so artsy and curvy and whatever. And it's like everyone has the same one. It's just a different shade of blue. Or sometimes it'll be the exact same logo over and over in just a different color. And then of course, their dental office name. And it's like, did you get that off of, Adobe stock images?
You make me sensitive given that our logo is a tooth and it's blue. And I'm suddenly leery of a redesign coming our way.
It's not wrong, but I don't think we need to I don't think you need to redesign. I just think it's something, if you are considering rebranding or you're branding for the first time, maybe try something different. My favorite is when dentists go with like a green color or something with like overall health, so they can go with like a tree or a leaf. I don't know why. I love it. Like some of our dentists have leaf and tree imagery, and something about it makes me happy because I don't feel that it's too dentisty, but it's also not just way out there to where you're like, what is this place? Like obviously they have the word dentistry or dental or whatever.
Yeah, I'm with you. It's funny we were talking I would not rebrand, to your point. Even an existing office. I just think I think dentists oftentimes underestimate the level of effort to rebrand an office. It's a significant event. When you're talking to someone about their logo, how are you getting them to talk about their vision?
Usually I like to go with the style first, like the colors come second, because you can apply almost any color scheme to whatever design you have. I tend to go with, what are your favorite style logos? What are your favorite brands that you feel will represent your office? So, if they're super into the modern design, like give me a couple examples of logos that you really like and tell me why you like them. Is it the line work? Do you like how simple it is? Do you like that there's flowers on it? Like whatever it is, getting to know them stylistically first helps a lot. And then after that, I can just do a black and white logo design and we kind of narrow it down. And then from there, I start applying colors. So usually, it has a lot to do with not only their personal style, but also their goals for the office. Are they going to be very spa-like? Are they going to be the family-friendly thing? Are they going to be, the high-tech? Whatever it is, we need to keep that in mind because obviously your logo and your colors are going to speak for you first. Especially if they're like a drive-by person that's like driving by the office and they're like, what's that place? I see this color and I see, the word dentistry and then what's the shape going on? It gives them a clue as to who you are.
Yeah, it's funny. When we talk about building websites, we talk about how one of the biggest challenges we have is dentists want to build websites for themselves. And because they have so much insider knowledge and dental specific information, we have to coach them. No, we really need to build it for the patients. But because they see their logo every single day, it's on every business card, it's on the building, it's on everything. I think they have to love the logo.
It surprises me how much pride dentists take in their logo.
It's so much part of your identity. We were talking about the Bluetooth logos earlier that it makes me giggle. We didn't, when our logo was really originally, we did not really understand that was such a common thing. And since then, we have had a couple of dentists be like, well, I would never put a tooth in my logo because it's a dead tooth. And, kind of what we were talking about earlier. But I love our logo, but I will say when people, there's been a couple of times where people have insulted it, and I take it personal because like it was my vision. I was the one who was like, yeah, I want the two-tone, the two colors of the blue, and I want the tooth in the middle of the heart to represent, that we're dental and client love and all the stuff. And it's so goofy. I didn't design it. I can't take credit for the design, but there's something about my personality that gets wrapped up in it for sure.
Yeah, no, I understand. When I design logos, I get attached, and sometimes I'm rooting for a certain logo design. And when the dentist doesn't go with it, I'm like, I feel a sense of butthurt a little bit, and I have to let it.
When you get when there's new office coming in, what does a brand package look like to you? So they come, you establish the logo, and then sort of how does it cascade down from there?
So if they don't have a logo, obviously we go through the logo design process. But from the logo, usually we go straight to business cards because that's usually the first thing they want, business and appointment cards. Sometimes we kind of combine them, and we have a business card in the front, and then the back is the appointment reminder for the client so they can have for the patient. From there, it kind of goes into, the normal letterheads, envelopes, thank you cards, any existing collateral that they have. I just did some new patient forms for Bellman. Just whatever that they use most commonly is the things that I try to push for first. So obviously the business cards. From there, it can vary, but a lot of times it's the same stuff. It's instructional cards. It's little things that they hand out to patients after every appointment. And there's nothing super crazy unless they have, branded booklets like orthodontic stuff. Usually that's the big one is there's like a whole thing on how to take care of your braces and aftercare and what happens if my bracket breaks, things like that.
Yeah. Hey, I'm working this. Do me a favor and just kind of summarize like what you like to see, stay away from this, lean toward this, sort of on the logo design for me. Okay.
Do you want me to say like in overall? Okay. I'm just saying.
Yeah. Just overall. Yeah. Something like that.
Okay. Overall, I would say avoid imagery that has just a plain tooth. We've seen it a million times. It's nothing new. I'm not going to say avoid blue, but maybe try something a little bit unique. Maybe try a purple or a green, something to help you stand out and feel just a little bit, more individual than other dentists. Try other imagery that's not a tooth. I love things that involve nature, the trees, leaves. Sometimes it's nice to just get a picture of health and things that involve that in overall health instead of just, your mouth.
And make sure you love your logo.
Make sure you love your logo.
Kristyn, this was great. And thank you for your time. And that was your Bite of Dental Marketing.